Module 5, Follow-Up Care. My name is Heidi Yuko. I'm a professor at North Dakota State University, and I will be your speaker for this module. We have two learning objectives for this module. Apply concepts to actively communicate with patients to assess for safe opioid use, and using standardized tools, screen patients for opioid safety. As you have learned in previous modules, issues can start to arise for patients related to opioid misuse or overdose after the initiation of opioid therapy. The ONE program is built to screen patients prior to receiving their opioid prescription. However, with the pharmacist patient care process, we know that following up with patients is an integral part of patient care. The ONE program has capitalized on the connection that pharmacists and pharmacies have developed with their patients. Ideally, 3 days after a patient receives their opioid prescription, someone from the pharmacy will place a phone call to the patient to assess for patient safety and other issues like diversion that can lead to opioid misuse or overdose. The program is designed to be delivered by anyone in the pharmacy technicians, pharmacy students, other staff, and pharmacists. It includes a 4-question survey or questionnaire, which assesses for patient understanding and provides opportunities to provide just-in-time education on medication storage, medication disposal, and signs of misuse or overdose. Through this program, your patient management system, like DocStation, Patientricity, etc., will have an automatic task generated within 3 days after the patient is screened with the initial ONE program screening. Once that task is generated, someone from the pharmacy will call the patient and ask the 4 prime questions and provide associated interventions or education based on the findings. These 4-question follow-up interventions are very, very straightforward. You'll see them here on the screen. Are you still needing an opioid for safe pain relief? Are you experiencing any side effects with your pain medication? Have you found yourself needing to take more of this medication than what the directions state? And do you have any questions for the pharmacist? The 4 prime questions are outlined on this patient screening tool or a triage tool for you. They're highlighted in yellow. Number 1, are you still needing an opioid for pain relief? Then you can see there are opportunities to provide education regarding safe medication storage and medication disposal options. These are 2 prime things to discuss with patients on follow-up regarding opioids because unused or unsafely stored opioids can lead to diversion of opioids from others. Question number 2, have you experienced any side effects with your pain medication? Question number 3, have you found yourself needing to take more of this medication than what the directions state? And question number 4, do you have any questions for the pharmacist? We'll get more into this screening form as we progress through this module. However, I want to take a minute just to talk a little bit about the education that you'll be able to provide on follow-up to these patients regarding safe medication storage and safe medication disposal options for opioids. As we saw on the previous slide with the patient screening triage tool, there's an opportunity to provide additional education for patients with these follow-up tasks. That education can include medication storage and medication disposal. With opioids, diversion is a high risk for patients to have their medication taken from them or to use someone else's medications. If medications are stored appropriately and disposed of when not needed, we can drastically decrease the amount of diversion that takes place, leading to some aspects of the opioid crisis.
Unused medicines can spell many things. Risk, if they're taken by someone they weren't prescribed for. Harm, if accidentally taken by a child or pet. Danger, or even death, if not used as directed. Unused or expired medicines may be hiding right in your home, in bathrooms, kitchens, bedrooms, purses, and anywhere you store medicines. So why put your family at risk? Safely dispose of unused or expired medicines before they can do harm. There are many ways to get rid of them. The best option is to find a drug take-back location. This could be a local pharmacy or a police station. These take-back locations may offer on-site medicine drop-off boxes, mail-back programs, or in-home disposal products. DEA's webpage can help you find a take-back location near you. Just enter your zip code. If you don't have a drug take-back location near you, check the FDA's flush list to see if your medicine is on it. Medicines on the flush list may be especially dangerous with just one dose if they're taken by children, pets, or others in your home. Flushing certain types of medicines, such as opioids, helps keep everyone safe by making sure these powerful drugs are not accidentally or intentionally swallowed, touched, or misused. Remember, don't flush any medicine unless it is on the flush list. If you don't have a drug take-back location nearby and your medicine is not on the flush list, you can dispose of it in the trash. For medicines you dispose of in the trash, FDA recommends that you mix them with an unappealing substance, such as dirt, cat litter, or used coffee grounds. Don't crush pills. Then, place the mixture in a sealed plastic bag before throwing it away. Scratch out personal information from the prescription label on the empty packaging. For complete details and instructions on safe medicine disposal, visit www.fda.gov/drug disposal.
As you saw in the video, there are many different options for safe disposal of medications. Many pharmacies have what's called a med safe. Other pharmacies may offer doTERRA drug disposal bags or DisposeRx packets. Many local public health units collect unused medications, and most police stations also have a means for disposing of unused medication. If absolutely necessary, medications can be disposed of in the trash. This is something that we don't always recommend. However, if it's the only option, it can be feasible. Medication storage is also an important aspect of safe opioid use, which we can assess and provide additional education on during these follow-up tasks. We do have lock boxes available that can be used for patients who are on a chronic opioid. Oftentimes, this is a great option if there's been a history of medication diversion from one's family member, friends, etc., or if there are small children in the home. Even having high school or college-age children or young adults in the home can be an indication that a lockbox would be a good choice. No matter what, we always suggest that opioids are stored in a safe, designated area. This should not be on the nightstand, on the kitchen counter, etc. It needs to be out of the reach of children or pets and out of the sight of visitors to the home, because opioids have a high risk of diversion, and also because diversion can lead to opioid misuse or overdose in others. This is what the screening form looks like. Number 1, are you still needing an opioid for pain relief? If the answer is no, then the pharmacy technician would ask, do you have any old opioids left over? If they say yes, you would remind them of disposal options like doTERRA and MedSafe, and then ask them how will they dispose of their remaining medications. doTERRA bag, at the pharmacy, or other, and then you'll document that. If they are still needing an opioid for pain relief, you would remind the patient of safe medication storage. So out of the reach of children and pets, out of view of any visitors, and in a designated area. So not out and about, somewhere that's designated for medications. And then remind the patient of the importance of medication disposal. So something like, once you're done with this medication, remember that it does need to be disposed of if you have any left. It can be unsafe to keep this in the home, as that can often lead to harm to your friends or family members. And then ask them, once you are finished with this medication, if you have any left, how will you dispose of that medication? The doTERRA bag at the pharmacy or other is listed there as well. Number 2, have you experienced any side effects with your pain medication? If they say no, you'll proceed on. Have you found yourself needing to take more of this medication than what the directions state? If they say no, again, you'd proceed on. And do you have any questions for the pharmacist? If the patient answers yes to questions 2 through 4, state, "Thank you, I'd like to have the pharmacist speak with you a moment to address some of the information you provided. Would you please hold?" And then you would call the pharmacist over, give them just a brief heads up. This patient stated they are experiencing some side effects from the medication and they'd like to speak with you. I would suggest asking all 4 questions before getting the pharmacist involved, as if they have answers to yes on more than one of the bottom 3 questions, you would want the pharmacist to be able to address all of those. We will go through a case example of a follow-up call with a pharmacy technician who is calling the patient 3 to 5 days after their 1 program screening initiation.
Hi Jill, this is Laura with the Medicine Shop.
Hi Laura.
Say, I noticed the other day you picked up an opioid for pain relief, and I was wondering if you are still taking that, or how's that going for you?
Yeah, I'm still taking it. I still need it.
Okay. And did you find that you're experiencing any side effects with this at all?
I don't think so.
Okay, so no like dizziness, drowsiness, constipation, anything like that?
I guess now that you mention it, maybe a little constipation.
Okay, well before we hang up, I'll have you chat with our pharmacist about that. Would that be okay with you?
Yes, I actually would like that.
Okay, and as the prescription is written, is that effective for you? Do you find like you might need to take more or less?
No, I'm just taking it just how it says on the label, and it's been working for me well.
Okay, great. I was also wanting to make sure that you were aware of medication disposal and or storage. Since you're still using it, we should talk about the storage.
Okay.
So you can do a couple of things. There's a lockbox. We sell those at the pharmacy. It has keys. It's like a little briefcase and it's only accessible to you. And then another couple of options is to keep it in a safe designated area. So make sure it's out of reach of children or pets. And then also be sure when you have visitors that it's out of sight for visitors to your home.
Okay.
And then if you find that you're done, that Tylenol's working fine and you don't need it anymore, there's several ways that you can dispose of the medication. There's a MedSafe at the pharmacy. It's a little drop-down door. You can just put your medicine bottles right in there. There's also a doTERRA bag where you would open the pharmacy bottle and put the contents in this bag, and it makes them undesirable, and then you can throw the bag away. We can send those home with you if you'd like. Otherwise, there's the local public health unit or the police station. And the final option would be to remove the drugs from their original container and mix them with something undesirable like coffee grounds, dirt, hair gel, something unsavory, and then seal it up and put it in the trash. Never put it down the drain or flush it. Make sure it's just sealed up in something unsavory, and then you can throw it away.
Okay,
Did
sounds good.
Yeah, did you have any more questions about either of those things?
I don't think so.
Okay, I'll put you on a brief hold and connect you with the pharmacist.
Awesome, thank you.
Yeah, thank you for your time.
Bye-bye.